Today we're here today for the Society of Thoracic Surgeons General Thoracic Surgery Database monthly webinar. Today is Wednesday, November the 11th. On the call with me today, let's see here from the STS, we have myself, we have Carol Crone, we have Addie Dolan. I think that's it from the STS. We also have Ruth Raleigh from the General Thoracic Core Group joining us today. From the IQVIA team, we have Paul, we have Paul, we have Jeanette, Jean, Melanie, and Joe. So welcome everybody, and thank you for joining me today. Standard agenda, you guys seen from the previous calls. We'll have our STS updates, then we'll turn things over to IQVIA, and then you all will have the opportunity to provide any user feedback, ask your questions, and we'll get those answered for you if at all possible. Let's see here. All right, I hope if I change the slide. For our STS updates, let's see, for public reporting, our next public reporting consent deadline is December 1st. For those that are not aware, I'm sure most of you are aware, the lobectomy for lung cancer and esophagectomy composite measures are included in the public reporting. The public reporting for the next round for thoracic public reporting will include data from the spring 2020 harvest. And also just if you have already consented for public reporting, you do not need to send in a new consent every year. Those consents do carry over. The only thing that you would need to do is one, if you have not already consented, is to please go out on the STS website and get that consent in prior to December 1st. If you have any questions about public reporting, you can please contact Sydney Clinton with questions, and her email address is there on the slide. She can be reached at sclinton@sts.org. For our harvest updates, the spring 2020 analysis results are currently being uploaded to the IQVIA platform, to the current dashboards. They are building those. We are expecting those results to be available to you all mid to late November. It's hard to believe we're already almost through November, halfway through November. It's crazy. We are now accepting data for the spring 2021 harvest. Data up through 12/31/2020 will be accepted. And then also, I actually had skipped over, the fall 2020 harvest is also in analysis at DCRI as we speak. So also, we've gotten several emails about the 2021 harvest schedules. Carol and I and Donna, we are working on those, and we hope to have those finalized this week, and we'll get those out to you all hopefully by the end of this week or possibly first of next week. So those 2021 harvest schedules will be coming very soon. Also, for our AQO wrap-up, just a friendly reminder, all AQO sessions will be available to the data managers that had registered for an entire year. The continuing education credits must be claimed by December 31st of this year. If you would like access to AQO and you were not able to make it to AQO, that access will be available for purchase in late November via the STS Learning Center. If you have any questions about getting that access, you can please feel free to email myself, or you can also email Emily Conrad, and Emily can be reached at econrad@sts.org. So you can feel free to reach out to either one of us if you have any issues accessing that, purchasing that through the STS Learning Center. I just wanted to share a slide with some important dates. We've covered most of these already, but just for a timeline, we have our General Thoracic Monthly webinar today, November 25th. Just a reminder that we did have a user group call scheduled for November 25th, but we did cancel that due to the holiday, that being the day before Thanksgiving. Most people will probably be traveling. I know I will be unavailable, but we did cancel that user group call that was previously scheduled for November 25th. Again, the spring 2020 analysis results are expected to be available by the end of November. This December 1 is our public reporting consent deadline. Our next General Thoracic Monthly webinar is scheduled for 1:30 p.m. Central Time on December 9th. And again, the last day to claim CEs for AQO is December 31st. All right. The next thing we wanted to do, I had a couple of questions, a couple of polling questions for you all regarding data manager education. I wanted to get your thoughts on things you would like to educational topics you all would like to see covered in the next webinars. So I'm going to go ahead and launch the poll. Let me see here. And let me know, Carol, can you see the poll? It says you all should be able to see them.
Yes, ma'am. I can
so I have to. Okay, great. Thank you. So I have two questions here. The first question, for the upcoming monthly webinars, would you like to use this currently scheduled time for the 5.21 upgrade review? And that would consist of the DCF walkthrough. And so yes, let's use these monthly webinars for the 5.21 DCF review. Or no, I would prefer to have calls dedicated solely to the DCF review, meaning that we wouldn't have any STS updates or IQVIA related updates involved. And then for our second question, STS is working to provide more educational webinars for our data managers. What topics would you all like to see covered on these webinars? I think Carol did open the chat for you all to be able to respond to those, for that second question. So if you could just please put your ideas into the chat box so we could get some ideas on topics for our upcoming webinars. Would you guys like to see webinars that are surgeon-led for educational purposes? If so, what types of topics would you like the surgeons to present on? If you would like to have presentations from other colleagues, from other data managers on quality improvement initiatives they have going on at their facility, what other types of things? Just anything you can think of, if you could just please put that in the chat box. Would you like to have a webinar from IQVIA on dashboard functionality, how to maximize your dashboard, the functionality within the IQVIA platform? Just please, again, just put your ideas into the chat box. That would be great. And someone had wanted to know, could we clarify the differences between the first one? So basically, the first one, yes, let's use these monthly calls for the 5.21 DCF review. It would be in just the same format here. We would still include the STS updates, an update from IQVIA, things like that. And the difference is, no, those webinars will be dedicated solely to walking through the data collection form. So we wouldn't also provide STS updates. Carol?
Hey, Leanne, this is Carol. So we could still have STS and IQVIA updates on the monthly webinars. The DCF walkthrough could take place of the educational portion of that webinar. So it would be walkthrough on the form, IQVIA updates, things like that. If we don't, instead of having an additional webinar per month, that would be separate.
Okay,
so
got it.
If we don't have, I think either way will work, depending on what folks would like to do. If we have updates from IQVIA, we would have to, of course, we want to update the sites if we have them available. And we're only doing the monthly webinar and the user group call.
Yeah, I'm just looking through some of the responses that were provided. We do have, someone had mentioned the new data managers webinar similar to the adult series. We do have a general thoracic new data manager webinar that was given, and it was recorded, and it's currently out on the STS website. So if you are having trouble locating that, if you just want to email me, Peter, I can get you access or point you in the right direction out on our STS webinars page.
Yeah.
Okay, Carol, put it in the
chat box.
Okay, perfect.
Yeah.
Let's see here. Pathology report, how to read them, what information should be used for the DCF, node stations, how to read the harvest reports and other reports from IQVIA, education, understanding how to interpret the harvest reports. That seems to be an ongoing theme. QI initiatives, sharing best practices. That's a great, okay, perfect. Excellent. These are great. Thank you all for providing this information. Carol and I will take this back and we'll start working on topics and for our next webinar. So thank you very much. We want to make sure that we're, making good use of your time and just providing educational things that's most relevant for you all. So we do appreciate your comments here and letting us know what all you would like this education to be focused around. So thank you very much. All right, perfect. All right, that's all that I have from the STS perspective for today. Next, I'm going to turn things over to Joe for our IQVIA update. So I'll let you take it away, Joe.
Thank you, Leanne, and hi, everybody. So let's get into some items that were released over the past weekend. The release date was November 7th. So starting with an update for the uploader and DQR, STS 4316. For analyzed procedures, if you are missing the surgeon or hospital NPI, a critical error will fire, which will prevent those records from being submitted. And for non-analyzed procedures, that should only come up as a standard error, which will allow the records to be uploaded successfully. So those validations were added in this past weekend's update. And then the next two, STS 4051 and 4052, some consistency checks were added for analyzed procedures. Excuse me. Some additional consistency checks were added to ensure the accuracy of your data. For example, there will now be errors that fire if you have a surgery date that's prior to the patient's admit date, or if the admit date is after the patient's discharge. So things like that will now be successfully caught during the upload process, and standard errors will fire to catch those for you. In regard to direct data entry users, STS 3106 and STS 3674, for these items, the patient ID and the record ID should now auto-populate on the form for direct data entry users. All right, moving into the next slide, the issues under review. So these items are a couple of the ones that we wanted to bring to your attention that are currently under investigation by our developers, starting with STS 3924. The patient alive 90 days post-procedure variable is being flagged as missing when it has not yet been 90 days since the surgery date. So that's something that we are looking into getting updated. STS 3884, this particular item has actually been resolved recently. Excuse me, for this, the clinical staging method for lung PET or PET-CT, that variable had been appearing on the report as missing when it should not have been, but this has been resolved since that was reported. And then the last one listed here is for the dashboard report, STS 3845. We are looking into the 30-day mortality variable on that report that we've had some information from users, some reports that it might not be categorizing records properly. So we are looking to get that updated and make sure that that is functioning correctly and giving you accurate results. If you have items that you have submitted that are not listed here, rest assured that they are under review. So if you do want an update or if you need more information on an item that you've already reported, please follow up on your ticket with the agent that you had been working with, and they can provide you with more information. And I think that does it for me. So I will turn the next portion over to Rhonda Murphy, who will be going over the risk-adjusted dashboard report.
Thank you. Let me share my screen.
Yep. I just stopped share, Rhonda, so you should be able to take over.
Okay, thank you. Hello, everyone. I'm going to show this from my developer environment. So this is how the report would look once it's actually active within the application, with maybe, some slight variance with how big the frame is and, things like that. But for the most part, this is what you will see when you log in. And I'm sorry, I just dived right in. Hello. So this is a walkthrough of the risk-adjusted dashboard report. And we're super excited to show you. I know that we've walked through some before, but we did meet with the surgeon leadership and they provided some good feedback and we've made updates accordingly. And so I just wanted to point those out today so that way we can see the differences from the last time that we looked at this report. And so what you'll notice is this new section called Legacy Reports. And after looking across what we had as benchmark reports, these were all under the benchmark report section. And after that meeting with surgeon leadership, it was noted that some of these areas are not the primary focus anymore, and there are some other focus areas that we want to bring more to the attention of the users. So those will be up here. They're still reviewing other areas, so this will be enhanced as this report is implemented. You will see enhancements to this, but initially when it releases, this is what we will have available to us. And I don't want to eat all of our time, but I just want to quickly run through a few examples again of what you will see here. And so going into this composite rating report, so the reports are set up again with the table up top and then the graphical display of that data down below. So in the top section, you'll get that your score, how you compare to the STS, the confidence intervals, and those other statistics like the min, max, the percentiles, the median. So that is in a table up top, but then down below, you have the graphical representation of that information so that you can, instead of just reading numbers, you can quickly see, for example, an overall where your score fell relative to the STS score. So here we performed better than the STS score. And then the confidence interval, how did I fall within that confidence interval? And then you have your min and max ranges here. So say you fell outside the confidence interval, but in one of those ranges, you'd be able to quickly see that here. There is this zoom slider at the bottom that I wanted to point out. So when I just had this zoomed in. So when you first log in, everything is set to the max view. And as you can see, these the absence of mortality, I'm not really able to see that confidence interval range and how I fell relative to STS. So using this slider, I can focus in on those areas and really see that distribution clearly. And then another thing I'd like to point out here is that, let's say you wanted to print this graph and share it with another cohort, or if you wanted to have this for later to review, setting this zoom slider and then using the export PDF functionality, which pulls together all the pages of this report into one single report, having that adjustment made, it will export that way. So you will have the ability to see that expanded view if you would desire. If you don't, you can reset that zoom by just right-clicking and resetting, or refreshing the report itself. Every time you leave the report and come back in, all of those reset, and you can refresh that way. There is a details tab for each one of those composite quality ratings. There's a rating details tab, which gives you that detail information counts by the different areas. So as we see here, our initial VIN support, we had 4, and then clicking on that 4 will provide the drill down to those 4 records in the space below. So you will have the ability to not only see the number, but to get to the bottom of that. So if there are any questions, any deeper analysis you want to do, you have that information right here available to you. As you've seen, I've been clicking this home button to get back here to the main page. So that is our navigation to the main area of the report. If that navigation, you're finding that to be a little too much, you don't want to click around, you can export this whole report into one PDF and scroll through the pages that way. And the report will present the same way it would if you were entering into each of the individual tabs. Something else to note is that in the previous reports, this lung cancer report was previously called pulmonary resections. After reviewing the logic behind what makes up pulmonary resections, surgeon leadership thought that it was clearer to describe these sections as the lung cancer sections. So that label change was updated, and so you'll see that now. There will be guidance that So in the paper report, there was guidance as far as what procedures make up each one of these areas. So for example, pulmonary resections is a collection of certain procedures. You will find that information in the report library that corresponds to those type details. So if there is questions about that, that information will still be available to you within the application in the report library. I've touched on some reports across these two areas. The reports will, they look and feel the same. So if I'm just showed the lumpectomy composite rating, the esophagectomy composite rating is the same report, just for a different area. Moving on to other reports, we have here that missing data report that you used to get. So all of those missing data areas, and then clicking on a row will return all of the records for that row. So for these 3 years, for the 3 years that are displayed, if I were to click missing age, if there were any records that qualified for that across these 3 years, those would be displayed below. So you can go back and review those and see if there's any corrections or things that we would like to update. And then the primary procedure report, again, just for the last 3 years, it's summarizing all of the data across those procedures by the organ system, the participant compared to the STS. And then now we get on to the benchmark reports. So these two areas look the same. You click on the area and then you're taken to a secondary landing page that provides to you the different benchmark areas that we're able to review. So under the benchmarks and then also under the legacy benchmark. It's those same kind of navigation points. And then clicking on one of those will open up the benchmark reports for that area that so I went to all esophagectomies and now I'm within that, those benchmark reports. And there is a next button that you can next through each one of these benchmark reports so that you don't have to continue to navigate back to the benchmark home and then go into each area. You can, once you're in one, navigate through the different benchmark reports. And then available within each benchmark report is not just the table, but up top we now have the graphs for the table below. So let's say I wanted to see my ASA classification. I can come here, pick that, and I have now the graphical representation of the data I'm viewing in the table below. So instead of just eyeballing numbers, I can quickly see, for this year, how I did relative to the year before and the different areas. So that is available within each one of the benchmark areas. You will notice that on the benchmark reports, we have double home tabs because one is to bring you back to the benchmark home for that procedure. And then if I was done reviewing benchmarks, I can click the main home button and go back here. There is as I mentioned before, the export PDF button that once I click this, it would pull together all the pages of this report into one PDF. I can save that and then open it for, I can save it there, it's okay. All the pages of the report will generate, and wherever you have your downloads saving to, that's where the report would go. And then, ta-da, we now have our report exported. So you can scroll through and look at your paper report.
Hey,
hey,
Rhonda, this is Carol.
Yeah.
I have a quick question, and I'm sorry if I just missed this. Are the legacy reports included in the export to PDF? Actually, I have two questions. And can you export to PowerPoint?
Yes, they will be available in the export to PDF.
Uh-huh.
And then, yes, you can export this. You can export all pages of the report to PowerPoint, Or if you were just in one page and you didn't want to export everything, you could pick active page or all pages. And
sorry if I stole your thunder. I was just excited to.
Oh, no, that's good. I'm glad you brought that up because sometimes I breeze over the PowerPoint option, but that option is available to you. And the PowerPoint view is another great export for this because it's starting to export here, as you see, because I picked all pages, but it will put everything together for you into individual slides. And you can, if you needed to have a meeting and you wanted a PowerPoint, you could use this. As you see, it exports really nicely to PowerPoint.
That's great. Thanks.
Yep, no problem. Thank you for that. So with that, I will close the demo and really looking forward to bringing this report live for you guys and giving you that data at your fingertips. Thank you so much.
Thanks, Rhonda. All right, let me share my screen. All right, and can you see my screen, Carol, the support plan?
Yes, ma'am.
Okay, perfect. All right, thank you so much, Rhonda. That was awesome. We're excited to get that released and to get the participants' hands soon. You guys have done a great job, so good job, good work. All right, so our finishing slides, you all are very familiar with this. IQVIA support plan. Again, just a reminder, I should put on the slide to please include your participant ID in all communications with IQVIA and STS, just makes our lives a whole lot easier and able to get back with you just a little bit quicker. So again, just please be sure to include your participant ID, the 5-digit participant ID, in your communications. If you're not sure what that is the ID number issued to you by the STS. It is a 40,000 series number. So again, if you have any questions regarding your participant ID number, just feel free to reach out to me directly and I can help you with that. Here is a list of resources that are available to you out on the STS website. We have our contact information. All of our webinars are posted out on our webinar page. Links to our recordings are out there as well, with training videos, and there's also a direct link to IQVIA, the data warehouse, out on the STS webpage as well. So lots of resources available out there to you on sts.org. Oops, sorry, a little too fast there. Here's my contact information. If you need to reach out to me for any reason, email is best. You can reach me at ljones@sts.org. And there is also my direct phone number. If you have any questions regarding database operation issues, questions regarding your contract, payments, your current contacts that are listed on your contract, please email us at stsdb@sts.org. And again, if you're not sure where your question goes or who you should be reaching out to, just please feel free to reach out to me directly, and I can get you in touch with the appropriate staff regarding your question. Before we move on, just a reminder again that our user group call for the 25th has been canceled, and we'll keep that rescheduled. We'll try and look and see if we can fit something in December. We also have another monthly webinar December 9th. Our days are filling up very quickly with all of the webinars and holidays coming up, so we'll do our very best, but we will have our December 9th monthly webinar, and again, that'll be at 1:30 p.m. Central Time. And that's all that I have for today. Next, we'll turn things over to you all for open discussion, for your questions. Again, if you have any questions, please submit those via the Q&A, not the chat box. And I think we have some questions already coming in, so we can go ahead and tackle those. If everyone is ready, let's see here. Our first question from Tracy: has there been a dashboard released this year? I've not seen one for our hospital as of yet. So note the dashboard that Rhonda just went over has not yet been released. We're looking to have that released by the end, hopefully the end of November here, coming very soon. And once that dashboard is available, the risk adjusted and your benchmark dashboards are available, you all will receive communication from the STS letting you know that, that the analysis results have been posted. So you will get communication from the STS when these dashboards are released. Our next question, and I think Ruth can help with this one. If a patient has a navigational bronch in OR prior to lobectomy that is only used to help locate lesion, no biopsy, do we code EBUS in 1780 section for medial-spinal staging? Similar question, navigational bronch in OR prior to lobectomy where needle biopsy is done but no frozen section results. Prior to OR, is this an EBUS in 1780 section for medial-spinal staging?
Yeah, so there's a difference between navigational bronchoscopy and EBUS. So the answer to both would be no, just based on that difference. Furthermore, I think we've answered the second question. So the navigational bronchoscopy itself would not be considered preoperative staging because they didn't wait for the pathology to return before proceeding with the resection. So navigational bronchoscopy does not equal EBUS.
Oh, great, thank you, Ruth. Let's see here. All right, our next question, do the downloaded reports include the patient details? That would be
this is
for
Jeanette.
IQVIA.
I can take that one. So I'm assuming that question is in reference to the demo that was shown of the dashboard. So if you have looked at that report and you've clicked in and you've looked at the details, then yes, printing the report either to PDF or to PowerPoint would include those details. So we do have some information about that within the guidance documents that we'll make available. And we would encourage you to refresh the report, which will reset it to remove any patient detail selection if you would like to do an export that doesn't include that level of information. But if you have drilled in and looked at it, then yes, that would be included in the downloaded or the printed version of the report.
Great, thank you, Jeanette. Our next question, actually two questions from Kelly. Do surgeons have access to this report and how would they get access? So yes, your surgeons do have access to this report as long as they are listed as a participant surgeon on your agreement with STS. If they are not listed as a participant surgeon, then you would, and they need access to this report, you would need to get them listed as a contact as a participant surgeon on your agreement. But I'm assuming they're already there, but they should have received an email with their own credentials to access the IQVIA system. If they have not logged in or if they have not received that email, they can reach out to us at stsdb@sts.org. I don't know if Jeanette or anyone has anything else to add on that.
Nope, totally agree.
Got it.
Thanks, Leanne.
Got it. All right. So our next question from Barb. DCRI harvest reports included the report overview and Appendix A, which contained helpful info for interpreting the results. Will IQVIA risk-adjusted dashboard results have referenced info? And the question to that is yes. That information will be posted within the library section, I believe, within the IQVIA platform. So when that report, those results are posted, the report overview and appendix with all the technical details for the models will be included, and you will have access to that information. Let's see. Our next question, I think this is regarding adult cardiac. So Carol, I'll let you handle that one, or do you want to answer it now?
Yeah, probably because we have a lot of overlap on this call. So this is Carol.
Okay.
The question is the STS adult cardiac harvest 4 deadline. Is this unchanged? It was mentioned on the last adult call that we would have more information on it this week. So we are, right now, the deadline is extended to December 2nd. STS will be sending out notification this week. There was a release this week with IQVIA on the adult platform this past weekend, and I think there was a couple things that needed to be checked out that sites were having issues with. So we wanted to get more information on the impact of those issues before we sent out communication in case that deadline needs to be extended further out. But as of right now, it will be December 2nd for opt-out. December 2nd for harvest close, and then that Friday for opt-out. Thanks, Leanne.
Oh, no problem. Thank you. Our next question, let's see here, Ruth, is unanticipated postoperative invasive procedure used for index procedure only or also for any readmission?
Oh goodness, I don't know off the top of my head. I'd have to look at the training manual. I'm sorry.
Yeah. Oh no, it's quite all right. Can you please submit that to the FAQs actually, so we could discuss that? Well, actually, we have a call tomorrow, and I'm getting ready to actually send out the questions. So if you could please submit that to the FAQs, and that way we could just make sure we're all on the same page. And I don't want to provide an answer if we're not 100% sure. So again, just submit that to the FAQs. That would be great. I don't see any other questions coming in at this time. Does anyone have anything while we're waiting that we may have overlooked or missed? Anyone from the STS side or the IQVIA side have anything they would like to add? Going once?
No, maybe a quick update on where we're at with the upgrade process, unless you've already given that, Leanne.
No, I have not given that yet. So the upgrade process, we are winding down. We are in the very final stages. We had a call with Paul today. We had initially, I know, as you're all aware, we had initially planned to go live January 1, but that was delayed. Upon further review, when we were going over the things with the surgeons, going over the data collection from the surgeons, when looking at the procedures and the category of disease section, we noticed there was a lot of duplicates. So we spent some time with the surgeon leaders to clean up those two sections. We're finalizing that today and this week. And the go live is delayed until July 2021. And the specs will be going to the vendors in January. So we are, again, finishing up the very last steps, and we'll get that over to the vendors in January. Carol, did you have anything to add that maybe I've missed?
No, that's exactly right. That's
okay.
Spot on.
Okay. Mindy wanted to know what is happening December 2nd again for opt-out.
I was just going to answer in the chat. It's the current harvest for adult cardiac harvest for STS. Will be communicating out further to the sites with more information on that harvest for close date as soon as we get feedback from IQVIA about the status of the release from this weekend.
Great. And also, Carol also put in the chat box the email to contact if your surgeon needs access to the IQVIA platform. Again, it's stsdb@sts.org. All the surgeons were sent their login information months ago. But it's, as Carol stated in the chat, it may have gone to spam, they may have missed it. So if they do need help accessing the platform or getting their username and password, login information, just email us at stsdb@sts.org and we can help facilitate that. Let's see here. I'm not seeing any additional questions come in. I want to make use of everyone's time, be respectful. If I don't see anything else coming in, I think that's about all that we have for today. Thank you everyone for joining. And again, just a reminder that our November 25th call is canceled due to the holiday, but we will resume on December the 9th at 1:30 Central for our next monthly webinar. And I think that is it for today. I see there's another question that came in regarding adult cardiac. So if you have, we won't tackle that on this call, but Carol can respond to the adult cardiac questions offline. But I think that's all that we have for today. So Carol, you guys have anything else?
Nope. Thanks all. Thanks everybody. Great job, Leanne and IQVIA.
Yep.
Andrew, thank you so much.
Yep. Great job, Rhonda, on the reports. They look amazing. And Melanie and team, you guys are doing a great job. So thank you for all your hard work. We really appreciate it. Thank you, everyone. I hope you all have a great day.